Welcome back to Living Local. According to the CDC, drug overdoses have dramatically expanded over the last 2 decades, with deaths increasing more than 4 times between 1999 and 2017. Local nonprofit Quad Cities Harm Reduction is working to increase awareness on the effects of this dangerous epidemic and what we can do to stop it. Joining us in studio today, we have Alexa Bird as well as Kim Brown with the Quad Cities Harm Reduction. Ladies, thank you so much for coming back to Living Local.
Thanks for having us.
So for those who may have missed that first segment, how did QC Harm Reduction get started?
QC Harm Reduction got started after my son Andy died of an accidental overdose May 25th, 2011.
So this was founded really in tragedy, but in an effort to increase awareness about this really incredibly serious epidemic we're facing. Kim, how has your experience as a registered nurse played a role in what you know about drug overdoses? Well,
I believe that when I was a young RN, it didn't play a big role. Drug overdose prevention education isn't something that we were really taught about in nurses training. We were taught a little bit about drugs and folks that use them, but not a big assessment intervention piece. So what I do now is I take those skills and I apply them to the assessment and intervention piece. So as an RN right now, what I think, what I'm looking around and seeing is that we need to do better. We have Narcan, and this Narcan has saved 402 lives in the Quad City areas, or it did in 2019, but we have to do better.
402 just in the last year.
In the Quad Cities. So what we need is our ER doctors to step up instead of treating and treating folks that have a substance use disorder, which truly is a disease of the brain structure and functioning. Instead of treating them and treating them, why don't we get ER doctors, get their 8-hour training and start providing wraparound services when people present either in sick, in detox, or having just overdosed.
Now, one of the things that Quad Cities Harm Reduction does is offer fact-based drug education. So what does that education look like? What are you trying to send a message about?
Well, our education more focuses on how people who use drugs are human beings and what we can do as a community to help them live healthier lives. We know that drug use affects the brain, and we try to strive to make sure that these people who are using drugs are treated like human beings. We do education at our office by training with Narcan. We also go into some of the local schools and do education on the real traumatic effects of drug use, and let people know that people who die from overdoses were human beings. They did have lives. We do have an education night every 2 months. Our next one is on March 24th at our Rock Island office, and that's going to be at 6 p.m.
Perfect, and I think it's so important to highlight that there is a stigma for, people who are addicted to drugs, and I think it's so important to clear that up and make people aware of it. How do you guys as a group advocate for drug prevention? If we can stop the problem before it ever starts, I think we can save a lot more lives, but how do we do that?
Well, we're never going to stop drug use. That is something that's not going to go away. The best we can do is, when people are using drugs, is try to help them be healthier about it and hopefully get them to the point where they're either not using drugs or they're using in moderation so it's not affecting their health.
And not only that, I think with our youth, and I think that's what you're targeting more, is with the youth and actual drug prevention, we need to teach kids the truth. If we teach children the truth and our teenagers the truth about drugs, give them the facts, what they can do to their body, how they're not mature enough to be using drugs, that they need their brain to be developed, their frontal lobe. Teach them the truth on why they shouldn't be using drugs. They're more apt to listen and not laugh.
Absolutely. I think it's so important to just cut it straight and be truthful about what are the consequences of drug use among our youth. Do you guys host any events in the community so people can get involved?
Yeah, like I said, we also have the Harm Reduction Education Night, but we have a yearly overdose awareness walk in August. It's usually the last Saturday of that month. We have a couple fundraisers. We're going to be having a trivia night, a music night, and all of that can be found on our website and our Facebook page.
Perfect. Now, I understand you guys are establishing an overdose prevention site in Rock Island County. So can you tell us more about what this will be?
Same thing we've always been doing, trying to prevent overdose and promote health. We'll be doing, we just expanded to a site over in Rock Island so we could be here working in Rock Island as we have been over in the Quad City side, engaging people who use drugs, engaging people before they use drugs, engaging the community, doing education and making sure people understand that substance use disorders are a disease of the brain structure and functioning. It's not a moral failure. People aren't bad because they use drugs, and you're right, the stigma will continue until we stop stigmatizing people that use drugs. Even the word addicts, we shouldn't use that word. We should say a person with a substance use disorder, a person with an opioid use disorder. And I did want to caveat on something. I want to piggyback back to the ERs.
Yes.
These ER doctors take their 8-hour training and they can prescribe Suboxone. Then get people into wraparound services within 7 days. That's what we'd like to see. That's what the next step I would like to see happen here in the local Quad Cities, is that we start engaging people right when we identify a problem. That's called assessment and intervention. It's not called treat 'em and street 'em.
Right. Now, when you share numbers like last year, 402 were saved by the Narcan just in the Quad Cities area, that seems overwhelming, and we haven't even talked about the numbers of people that did die from their substance use. So what can we do as a community? What's the next step that we can take to support the mission of QC harm reduction?
You can come in and get trained. Every community member should carry Narcan. It takes 5 minutes to get training. We hand those kits out for free. If you don't want to come into our office, you can get Narcan through your insurance. And all it takes is 5 minutes of training. Anybody can save somebody's life.
Awesome. Well, thank you so much for providing these resources and the education to our community. Alexa, Kim, thanks for being here.
Thank
Thank
you.
you.
All right, for more information, you can visit the office at 1600 2nd Avenue, Rock Island, or call 563-265-1859. We'll also have those details posted on ourquadcities.com.